black trainees, not just black, black, minority ethnic, people of colour, trainees, some of the additional issues they face within the programme that could be led by someone that's not of colour and might not understand some of the pressures that we might face in a group session, or even understanding some of the theories that have come from, based on cultural situations that aren't congruent with what we're used to.
Yeah. And that's what makes the training difficult as well. That we're not seeing ourselves in the theory.
Yes.
It's very colonial, it's very white, European, heterosexual, yeah,
absolutely.
Sexist, racist, all of them. Yeah. So that makes the course difficult as well. I can only speak for myself in the foundation year. I'm having to pull out theories and concepts from current BME psychotherapists, psychiatrists, psychologists, and add that into my essay. It's not. I'm not pulling things from the 50s and the 60s, although we have to still add the 50s and those theories from and seeing Freud on the damn screen and just thinking, what's this got to do with me? And actually, now I have to pull up, okay, maybe not, okay, maybe. Yeah. And this is the only context we're looking at. And then for me to start talking about my Ugandan heritage and where I've come from and actually how that's been picked up from my culture. I've seen that elsewhere in my culture. This is appropriation in some settings. It's difficult as well to have those conversations in that space. It is challenging to do that.
Yeah, for the year of the foundation, I felt so stupid. It wasn't just my colour being in a minority, it was my class, it was my education. The education I was born into that I feel let me down. It's entering a profession which is predominantly middle class and upper class, and I'm working class and I've not got a degree. You do most of these courses, they assume you can write a postgraduate
level, yeah.
And I could just about spell and, write my name. I'm calling it as it. I did well. I passed, but I had to do so much more work than everybody else in my class because they already had degrees and went to university, so could write an essay, knew how to write an essay. I had to learn how to write an essay before any of the other things I had to encounter.
Yeah.
If you guys were not there, and my tutor of colour was not there, I probably would have walked.
I mean, there's lots of work being done in the black psychology area to realign some of these theories. I think grassroots, we deal with what's in front of us. Yeah. We have to face the society we're in, the situation we're in. We have to find a way to peel everything back, look at that, and then decide what's next. What does this mean for us? What can we see? What can we do? What do we have the power to do?
A lot of the grassroots organisations around domestic abuse are suffering heavily, and a lot of the money is being funneled into the generic services that are not necessarily trained in understanding the needs of the
community. Would you say that there's work to be done in trying to pull some of those organisations together and raise more awareness?
The organisations are already pulling together. They are already pulling together. They are joining in their tendering process. So it's not just this organisation that they're coming together, but again, under this austerity that we are under, that's not the goal. The goal is not to funnel money in there. If anything, people have to, like what I said before, people have to get very unwell. Kids have to be killed on the streets for this money to be funneled in, and not funneled in to the grassroots organisations, the young black and brown boys that have gone through that life, that can feed back in. Yes, there is money, but not.
Okay, what would we do? We're saying we want funding, we want help with our training, because once we finish, we're going to launch ourselves into the community and do these amazing things. What amazing thing would we do about that?
For me, I'd like to spread the word in the community to get more people interested in the profession.
Yes.
Okay.
Yep. Particularly men.
Yeah.
Because within our foundation there was no men. No black men. And people keep saying what's happening on the street among our young black men. Yeah, so get more people interested in the profession. Yeah.
But once they're in, getting them through the doors.
And then supporting them when they're through the doors with the funding, take that barrier out of the way. I think we're just the tip of the iceberg.
Yeah.
You know, I'd like to go back to my training institute in about 10, 15 years and talk and look over a sea of difference. And when I talk about my experience, when I started my training 15 years ago, I want people looking back at me thinking, really? It's not like that now. Okay. That's what I want. That's what I visualize. That's what I hope for.